everyone. I did a little intro in the chat, and I'm the only one who answered Colin's question about favorite candy. So feel free to continue to think about that question and engage here and let us know what your favorite candy is. We need a little bit of fun while we talk about Medicare, which can sometimes be heavy and a lot to take in. So we're just waiting for the slides to pop up. Any chocolate? Yes, I agree. Any chocolate's pretty good. But welcome again. It's Medicare 101 for your business and for your eligible employees. Great, I see the slide now. The agenda that we're going to talk about today. I'm going to cover the basics because, again, Medicare can be very confusing and complex. And if you want to help your employees learn about Medicare, it's good for you to have either a reminder of what the sort of the basics of Medicare is, or if you yourself don't know the basics and foundational knowledge of Medicare, this is your opportunity. So this is just good information to know anyways, whether it's for your employees and you want to help them, whether it's for yourself. You might be in the situation where you're trying to navigate the Medicare and health insurance world right now, or if it's for a loved one, perhaps you're trying to figure this out with your spouse, or perhaps you're a caregiver and trying to navigate this for a loved one. So we're going to cover the basics. I'm going to give you some tips on how you can educate your employees on Medicare and what your role is, and we'll provide some really great resources and tools. So some common questions that we'll first cover. What is Medicare? And what is covered? That sounds pretty basic, but we're going to start there because it can be very overwhelming trying to understand Medicare. Even I, who work in the Medicare education space, sometimes forget, sometimes can't, understand all the complexities. Things sometimes change. So it's good to start with the basics and have a firm foundation from there. Then we'll talk about enrollment. When should I enroll in Medicare? What happens if I don't enroll? There are penalties, there are some repercussions. So we want to kind of raise those up front so that you know how to navigate. How will Medicare work with my existing healthcare? Then we're going to talk about your role as a business owner. What do we expect? What do we think your role is? We know that most of you are probably not wanting to be Medicare experts, and most of you are not wanting to provide the wrong type of advice if you're giving guidance to a employee. But we think it would be really helpful for you to be the point of contact to be able to refer them to resources if there are questions that come up. So your role is to provide Medicare eligible employees with educational materials about Medicare. It's to connect employees with unbiased sources of information, sort of third-party, trustworthy information sources that we will be sharing with you. And it's also to help Medicare eligible employees avoid enrollment penalties. Those are those pitfalls that it's good to know up front and that we want more people to be aware of when they're making their enrollment decisions so that they don't incur these penalties, some of which are actually lifelong. What is Medicare? Medicare is a federal health insurance program for people who are mostly age 65 and up. It's for those under age 65 with certain disabilities. It's also for anyone at any age with end-stage renal disease, also for people with permanent disabilities, people with ALS, which is also known as Lou Gehrig's disease. Sorry, I keep pressing the slide twice. When it comes to what employees are responsible for paying, what you're responsible for paying, if you're thinking of yourself as someone who has Medicare, these are the basic insurance terminology terms that we want to define and make sure that there's a clear understanding of what this works, because these are things that will apply to Medicare coverage as well. Your monthly premium is the amount an individual would pay to Medicare or a private insurance plan for an individual's healthcare and prescription drug coverage. That's something that you pay monthly. The deductible is the amount an individual would owe for healthcare services that the health plan covers before your health plan begins to pay. The deductible may not apply to all services, so it's sort of the threshold amount that you need to meet before insurance sort of kicks in. Your coinsurance amount is the amount an individual may be required to pay as a share of the cost for services after they pay any deductibles. Usually this is represented as a percentage. So sometimes it'll be, something, a certain service or benefit is going to be 80% covered, and the 20% is the coinsurance, which is what you would pay out of pocket. Copayment is the fixed amount an individual would pay for a covered healthcare service, usually when they receive the service. The amount can vary by the type of covered healthcare service. So usually when you see your primary care physician or a specialist, or if you go to get prescription drugs, there is a copay amount, which is sort of a fixed set amount that you'd pay upfront. What does Medicare not cover? Medicare does not pay for vision, dental care, in most cases, hearing, or long-term care, such as an extended stay in a nursing home. Now, there's some exceptions, but in general, Medicare does not pay for these services. Medicare Advantage plans may cover these, but traditional Medicare does not, and we'll go over what Medicare Advantage and what traditional or original Medicare is. We will get into the differences in a moment. The fact that Medicare does not cover long-term care services is a surprise to a lot of people. Medicare only helps cover certain services if they're medically necessary, and it does not cover custodial care, which is things like helping with activities of daily living, such as bathing, dressing, eating, toileting, meal prep, housekeeping, that kind of stuff that many people as they age do need support with, is actually not something that's covered by Medicare, and just something that we wanted to raise because it is surprising for many people. So we're going to go now into the different parts of Medicare. Medicare can be a little bit of an alphabet soup. There's different parts, and sometimes maybe parts isn't really the best word to describe it, and you'll see why very shortly. But we'll start with A. Part A is hospital insurance. Part A will cover things like inpatient hospital care, some hospice and home health care, and some skilled nursing facility care. The Part A costs for 2022, typically there's no premium for Part A, but there are deductibles for 2022. And the deductible for this year is $1,556 for days 1 through 60 of inpatient care. The deductible can be applied again for additional hospitalizations after 60 days. So Part A does have this deductible, and there's also coinsurance in addition to the deductible. Once the deductible is met, there's this deductible in 2022 for inpatient costs for each benefit period. The benefit period ends when you haven't gotten any inpatient hospital care for 60 days in a row. If you go into a hospital or a skilled nursing facility after one benefit period is ended, a new benefit period begins. So those are very general information about the costs for Part A and what Part A is, which is hospital insurance. Moving on to Part B. Part B covers medical insurance. This is going to cover things like doctor visits, outpatient hospital services, durable medical equipment, so things like wheelchairs, walkers, possibly hospital beds, for example, rehabilitation therapy, laboratory tests, x-rays, mental health services, and some preventive services to help maintain your health and detect problems early when they are at a more treatable stage. These are sort of Medicare approved preventive services. So think about your doctor's appointments, lab type of things. That's all going to go under Part B. The cost for Part B in 2022, the standard premium is $170.10 per month for those enrolling in 2022. Premiums do go up for those with higher incomes. Individuals who earn more than $91,000 a year, or couples earning more than $182,000 a year, will pay premiums based on their income. The annual deductible for Part B is $233 per year, and coinsurance is 20% for most services. Going on to Part C. So Medicare Advantage, I'm going to kind of take a step back, is a total other pathway per se, not so much subpart, but pathway for Medicare on how one can get their Medicare coverage. Medicare Advantage plans is what Part C is. it's an alternative to original Medicare. So plans are offered by private insurance companies. All plans include Parts A and B, and in most cases, Part D. By purchasing a Medicare Advantage plan, this may limit the ability to purchase a Medigap plan in the future. Medigap plans are supplemental plans. So Medicare Advantage plans are provided by Medicare-approved private insurance companies. You're normally limited based on network. We'll get a little bit more into that. But Part C is not really sort of something you would get in addition to Part A and B. It's an alternative. So Parts A and B and D are usually called original Medicare, and Part C is Medicare Advantage. You sort of choose which path, one or the other, on how you want to get your Medicare coverage. Oops, keep clicking. Part C, Medicare Advantage. How it works. In general, you must live in a plan's service area, so you might be a little bit limited in the network. You have to use providers in the plan's network. You have to stay in network in order to take advantage of Medicare Advantage plans. You usually may have to pay an additional premium, and you may have to follow insurance company rules, such as requiring a referral to see a specialist. And this comes with pros and cons. So you need to weigh your own individual situation, or you need to provide guidance if someone's asking you questions about their Medicare and options and which way to go. There's pros and cons to each. Medicare Advantage plans, they are available in most parts of the US, but you must live in this plan's service area, as I mentioned, and you must choose from plans that are only available in your area and sign up directly with that plan provider. Medicare Advantage plans pay for the same healthcare services as original Medicare, but they may also pay for additional healthcare services. So things like vision, hearing, dental that I mentioned is not traditionally covered by original Medicare may be covered through Medicare Advantage, which is why you may pay a little bit more in terms of a premium. With Medicare Advantage plans, you can usually only go to doctors, specialists, and hospitals on the plan's provider list. The plans may limit coverage or provide no coverage at all if you go out of network. So you do have to pay attention to the rules in terms of staying in and going out of network. You also have to pay attention to, do you need to get a referral? So that was sort of taking a step away and going to what another alternative pathway is for you to get Medicare coverage, and that is Medicare Advantage. And now going back to the alphabet soup, Part D is, for me, easy to remember, drugs. It's prescription coverage. So Part D for drugs, prescription coverage. This is part of original Medicare. It's something that you would have to purchase in addition. It helps cover the cost of prescription drugs that you pick up at the pharmacy. It's run by Medicare approved private insurance companies. The Medicare Part D plans will help cover some of the costs. You must join a plan run by an insurance company that's approved by Medicare. So this is one area, if you go the original Medicare route, where you do have to do some shopping around. And if an individual is eligible to join, but you don't, you could get a late enrollment penalty. So Medicare is provided by standalone Medicare prescription drug plans that offer drug coverage only. It's also could be included by Medicare Advantage plans that offer coverage for both prescription drugs and healthcare. So I mentioned if you go the Medicare Advantage route, oftentimes they will include Part D coverage in addition to the A and B. Looking at costs for Part D, people enrolled in Part D may pay things like monthly premiums, co-payments, or co-insurance. There's an annual deductible of $480. Similar with original Medicare Part B, people with higher incomes may pay higher Part D premiums. Premiums for Part D, they are going to be higher for individuals earning more than $91,000 a year, or for couples earning more than $182,000 a year. In general, after you meet the $480 deductible, you are responsible for 25% of your covered Part D prescription drug costs until your total spending reaches the coverage limit, which is $4,330 in 2022. Very basic information about Parts A through D. Here's just another visualization to capture sort of the different pathways, as I mentioned. Medicare Choices, you can have sort of parts A, B, and D through original Medicare. You have A and B, which is hospital and medical. D is your drug plan that you'd be shopping for and picking and selecting your plan for that. That's original Medicare, sometimes referred to as traditional Medicare. Usually, those same services and benefits are going to be part of Medicare Advantage, which confusingly is called Part C, even though it's not really, I think, a part in that way. At least I don't think of it that way. So I think of it as two alternative options for how you think would be best to get your Medicare. Or if you're helping someone else, what they think would be best for them. So going back to original Medicare, which is sort of the a la carte version, it's a fee-for-service type of program. It's going to include parts A, hospital insurance, and B, medical coverage. You generally can go to any provider that accepts Medicare. Pay attention though, because even though a provider accepts Medicare, they may not be accepting new patients, for example, if you're switching. So if you like your current provider and you want to go with original Medicare, ask them about Medicare coverage and if they accept Medicare. You can generally choose and join Medicare prescription drug plan for drug coverage. That's something that you would buy separately. So that was just sort of a recap of original Medicare versus Medicare Advantage. We went through the parts, which I think are pretty basic information that's really good to get a handle. But again, totally understandable. It can get kind of confusing pretty easily. Let's now talk about enrollment. When should your employees enroll in Medicare? It's one of the most common questions that you're going to get. Sometimes the question is triggered based on age for employees who are turning 65. Sometimes it's based on a life event, like things like retirement or another type of thing. A spouse is sort of switching jobs or benefits. So a lot of times these trigger these questions about benefits and about health insurance coverage, and Medicare is at play. There are three enrollment periods in general to think about. You can hear these terms often, but it's important to know the difference between them. Initial enrollment is going to be the very first time that you enroll in Medicare. We'll dive deeper into that. Special enrollment is a special enrollment period that's based on, like I said, the sort of triggering life event type moments that you might get, like retirement, for example. That's going to open up a special enrollment period that's unique to you. Then there's a general open enrollment period, which is catered more for those people who are already enrolled in Medicare and they are reviewing their existing coverage and they may or may not want to make changes. Open enrollment is that time of year, which is actually a set time every year. It's October 15th through December 7th. It's in the fall. And that's when people can make changes to their existing Medicare coverage. But if you're enrolling for the first time, it's usually an initial enrollment period for you or a special enrollment period for you, depending on your situation. Let's go to initial enrollment. If employees are receiving Social Security already, before the age of 65, they are actually automatically enrolled at age 65. Employees have 7 months to enroll, 3 months before the month they turn 65. Then the month they do turn 65, and then the 3 months after they turn 65. So it's in a 7-month initial enrollment period. And there is late enrollment, and that means you will pay higher Part B and Part D premiums if you don't enroll during that initial enrollment period and you needed to have done so. So I'll repeat that initial enrollment period again. It's a 7-month window. It's the 3 months before the month of your 65th birthday, the month of your 65th birthday, and the 3 months after your 65th birthday. We highly recommend that you enroll if you have to enroll during initial enrollment period, we highly recommend you enroll during the 3 months before your 65th birthday, just in case, to avoid any sort of coverage gaps or anything like that. All right. Special enrollment is the exception for when you are initially enrolling into Medicare for the first time, but you delayed it and had a valid reason to delay it, which would be something like if you were continuing to work and you had sort of your job-based coverage. So for employees who do not enroll in Medicare when first eligible, they can enroll during a special enrollment period. The period is available to those who are over age 65 employees who are currently working and covered by employer health coverage. Employees who lose their employer coverage either at the end of employment or at the end of their coverage. So it's normally this 8-month window, I believe, that you would get. That's triggered by sort of that event. If you continued to work, you did not enroll during initial enrollment because of this exempt reason, you are able to enroll in this. Employees who lose employer-based coverage or they retire do have these 8 months from losing coverage to enroll in Medicare without a penalty. So you have 8 months. After 8 months, these employees may face a penalty. Employees who missed initial enrollment for no exempt reason can enroll. That's yet a different enrollment period for you. That would be called the general enrollment period. That's the start of each calendar year. Employees will most likely incur a penalty, though, when you enroll during general enrollment period. So you do have to pay attention to this, especially if there's sort of retirement sort of triggering discussions about Medicare enrollment. It's something that you do want to pass on, because if they didn't enroll in Medicare during initial enrollment and decided to stay with employer-based coverage, that's fine. If that's an exempt reason, they would then have the special enrollment period to enroll. But if they don't enroll during the 8-month window in the special enrollment period, they would then have to enroll during general enrollment, and they may face this penalty, which again could be avoidable with a little bit of help and education. We'll talk now about open enrollment. I told you this is the one time of year where existing Medicare beneficiaries can make changes to their plan. So at initial enrollment, there's a lot of decisions that need to be made. What kind of plan should I get into? How do I, make decisions? Which is the best one for me? Am I locked in this forever? The answer is no. You really have to make decisions for your health care for 1 year. Think about it sort of in 1 year increments. If for whatever reason you're not satisfied with what you chose in terms of how you're getting your Medicare coverage, you can make changes during the open enrollment period. That's October 15th through December 7th. You can switch from Medicare Advantage plans and join another Advantage plan. You can switch from Medicare Advantage back to original Medicare or vice versa. You can switch, join, or drop a Medicare Part D plan during this open enrollment period. Let's say your prescription drugs changed from year to year, and the drugs, after reviewing your Medicare Part D coverage, are no longer covered, or there's a different formulary. A formulary is a term that talks about the list of drugs that are covered by the prescription D Part D plan. Let's say there's changes and you need to switch because it'll be more affordable. You have to do this due diligence, and I think you do a lot of that at initial enrollment, but just a reminder, for open enrollment, that's something for existing Medicare beneficiaries, and we do encourage people to take an active role in reviewing their coverage, determining if they're satisfied with it, seeing if there's a more affordable option that offers the same level of coverage. This is your opportunity to do that and for your employees to do that. So that's open enrollment period. A lot of these different enrollment periods come into play. So let's talk about penalties. These are the penalties that we want to avoid. For Part A, there is a Part A is hospital insurance. There's an up to 10% increase for monthly premiums for twice the number of years not signed up. For Part B, there's a 10% increase for monthly premiums for every 12-month period not signed up. The penalty will stick for as long as you have Part B coverage. And that can add up to a lot. Part D is multiplying 1% of sort of the average, the national base beneficiary premium, which in 2022 was $33.37. Take 1% of that times the number of full uncovered months that you didn't have Part D or creditable coverage but could have. And then that is another penalty that you could incur. So these are the things that we really want to raise awareness of. They're important to think about, particularly during initial enrollment when enrolling for the first time, because it can help encourage people to avoid this and to be cognizant of it, and to know and be more aware of their sort of rolling windows that they have to enroll. So Medicare and your business. Let's talk about how employer size determines Medicare requirements. In general, if you are a company that has fewer than 20 employees, considered small business, eligible employees must enroll in Medicare when they're turning 65. For small employers, Medicare becomes the primary insurance, and any work-based coverage that you may offer will then become secondary. For larger companies, those with 20 or more employees, eligible employees can choose to enroll in Medicare if they would like to, or they can stay on their work-based coverage. In general, with large employers, Medicare will be the secondary insurance to work-based coverage. So size of your company does matter in terms of what becomes primary and secondary, but it also matters in terms of what's required. So if it's a smaller company, eligible employees must enroll in Medicare, and then the employer-based coverage becomes secondary. For large, it's the reverse. Employer-based coverage is going to be primary. Medicare will become secondary. We'll even show there's a use case where they may not even enroll in Medicare and they could delay that. I think that's our next slide. So here's a common scenario for small employers. If they work for a small employer, if you are a small company, they would enroll in parts A and B during initial enrollment. Initial enrollment is that period that centers around their 65th birthday, the 7-month window, 3 months before they turn 65, the month of their 65th birthday, or 3 months after. For large employers, they could enroll in parts A and B, go ahead and enroll in Medicare during an initial enrollment. They could enroll in Part A only during initial enrollment, but then delay Part B, assuming that this employee is still going to be covered by an employer-based plan. They can do that until enrollment during their special enrollment period. So let's say they retire, that's when the special enrollment would trigger, when they retire or when they lose their employer-based coverage. Another scenario is you delay Medicare Parts A and B enrollment altogether, and then you enroll during the special enrollment period. Regardless, the large employer has the work-based coverage that's going to, in general, stay as primary coverage. So, initial enrollment education timeline. This is you for your role as an employer, what we suggest you could do to help. I think it's a lot of reminding more than anything. It's not asking you to be the expert and you to be the one to answer all the questions. We are asking that you know where to point people to in terms of resources and referrals, but in general, to know a timeline. So if you happen to know your employees who are turning age 65 soon, and you work for a small company, we have this education timeline that could be helpful. Even if you don't work for a small company, this is just good knowledge to have around the age of 65, so people can become more socialized in thinking about Medicare and getting more used to it. So we suggest maybe 6 months before the month before their 65th birthday, send a little kind of general overview about Medicare, some general information, some website links that people can start checking out, as there's some people who are great planners and know things and like to do things early and well in advance and like to be prepared. This is a good time to provide general information. It's around 6 months when they're 64 and a half. As you enter getting closer to their 65th birthday, around 3 months before their 65th birthday, that's when the initial enrollment period triggers. And that's when I said we really recommend people enroll is at the beginning part of their initial enrollment window, and that's to avoid any potential coverage gaps. And so initial enrollment will open, and that's another opportunity to send maybe a little bit more in-depth educational materials. AARP has a number of resources. If you don't have any, feel free to point them to us or to the number of resources that we'll share. Medicare.gov, for example, another great resource to have information about initial enrollment, what kinds of choices and that kind of thing to make. So during that initial enrollment period is a great educational time period to continue to remind people so that they can avoid those penalties. You might have the third-party resource list like I talked about, so AARP being one, CMS, you'll hear from Maggie Flowers from ACL and from SHIP later today. Later in the session, and then maybe do one last reminder, a final communication with, here's just one more reminder that if you need to enroll in initial enrollment period into Medicare, now is the time to do it. You want to avoid penalties. Any kind of nudge, I think, would be helpful to your constituents, to anyone that you're trying to help, whether it be for employees or even for yourself, like I said, or many people who are caregivers, family caregivers who are helping older loved ones navigate this entirely complex system of Medicare and healthcare coverage. This is a really good time period to do that, is during initial enrollment. So again, not asking anyone to be experts, don't want to lead anyone in the wrong direction in terms of pointing people to specific, let's say, Medicare products necessarily. It's really just getting them to understand the things they need to consider to make the best decision for their own individualized situation. And there's lots of help for that, and you don't necessarily have to be the person to do that. You want to have clear and consistent communication. You want to refer people out to these trusted and reputable sources. And you want to continue this education. Educate employees about Medicare prior to eligibility. That prime audience is going to be the people who are 64 and a half years old, approaching age of initial enrollment. But there may be a number of caregivers in your organization who are providing help for a loved one, and any education that you offer could be helpful to those people as well. So don't necessarily leave out information for people who are younger than 64 and a half, because there's a lot of people who could benefit from education around trying to understand Medicare. So now let's get to the good stuff, which is the resources. First and foremost, I'll point you to Medicare.gov. Medicare.gov is a great website. There is a phone number as well. I know for a while they were focused on sort of COVID-specific inquiries on the phone line, but I believe you can still call that 800-633-4227 number. I believe it's 1-800-Medicare. That's something easy to remember if you have a phone that correlates with the letters. Medicare.gov is an official U.S. government site for Medicare. The Medicare program is led by the Centers for Medicare and Medicaid Services, also known as CMS. I know one confusing aspect, though, is that the Medicare program is administered by the Social Security Administration, which is why Social Security is sort of involved with when you initially enroll. There's a dependency on, if you're already collecting Social Security, you may get automatically enrolled in Medicare by the age of 65. Always good to double check and to have these things in writing. Wait for your letter. As you approach age 65, be proactive. But Medicare.gov is a really great resource to turn to. There's all kinds of tools on Medicare.gov. There's a plan finder tool that I highly recommend if you want to compare different healthcare providers. I believe they have a care compare tool as well that's fairly new. Wonderful resources on Medicare.gov. Medicare Right Center is a nonprofit organization that also has a phone number as well as a website. AARP does collaborate with Medicare Right Center often. They do a lot in terms of sort of advocating for Medicare for people age 65 plus, another sort of nonprofit trusted third-party source that you can turn to. And then we're going to have our SHIPs, the State Health Insurance Assistance Program. Maggie Flowers from the Administration on Community Living is going to talk to us a little bit more about SHIPs and how they can really help you navigate Medicare. The website is right there, as well as the phone number, and we'll dig a little bit deeper into that as we go through her slides. So Maggie, again, thank you for partnering with us on this session, and welcome. And thank you for telling everyone here about this wonderful resource.
Yes, thank you, Tricia. I am excited to be here, and I'm excited to share with you all a little bit about the work of ACL and a little bit more about the work of the SHIPs. And I want to give a shout out to all of the SHIPs I am seeing on this call. So for the employers that are on, look in the chat, you'll see many SHIP directors and other team members from around the country who've joined us here today. So welcome, everybody. First, just a little overview about ACL for those who may not be familiar. The Administration for Community Living is a division of the Department of Health and Human Services, and it manages the State Health Insurance Assistance Program, or SHIP. Sometimes in your state, it may be known as something else. So if you look at the shiphelp.org website, that'll help you locate your local SHIP, but we'll get into that in a minute. ACL was created around the fundamental principle that all people, regardless of age or disability, should be able to live independently and fully participate in their communities. Our mission is to maximize the independence, well-being, and health of older adults, people with disabilities across the lifespan, and their families and caregivers, and our focus is on community living for all. ACL provides funding to states to provide services for a broad range of individuals. Our programs support Medicare beneficiaries, older adults, nursing home residents, people who are Medicaid eligible, family caregivers, and younger people with disabilities as well. We use a person-centered approach to services, offering a range of community-based services through a network of state and local partners. ACL programs help older adults and people with disabilities find supports and services that they need in order to successfully live in the community. So that includes services like Medicare education and counseling that we're going over today, but also meals at home or in community centers, activities at senior centers, transportation, and assistance with medication management, just to name a few. So I put our website here. If you want to learn more about the work of ACL and other programs we support, you can go to acl.gov. Next slide, please. So the State Health Insurance Assistance Program works with state offices, local agencies, and community providers across the country to establish a community-based network of counselors who provide assistance in person, by phone, and virtually, make group presentations, and use a variety of media sources to educate people about Medicare. SHIP is a national program. It offers one-on-one assistance, counseling, and education, not only to Medicare beneficiaries, but their families and caregivers to help them make informed decisions about their care and benefits. Additionally, SHIP services can support people with limited incomes and Medicare beneficiaries under the age of 65 who have disabilities and maybe and people who are dually eligible for Medicare and Medicaid. The SHIP mission is to empower, educate, and assist Medicare eligible individuals through objective outreach, counseling, and training. And there are 54 SHIP grantees, so that is one in all 50 states, Puerto Rico, Guam, the District of Columbia, and the U.S. Virgin Islands. SHIP services are delivered by the state units on aging or the Department of Insurance, depending on the decision in their state. And it's done in partnership often with their local area agencies on aging and other community-based partners. Nationally, there is a network of more than 2,200 local sites and over 12,500 team members, including staff, in-kind professionals, and volunteers working on this program. In addition to SHIP services, many of our grantees also provide the Senior Medicare Patrol, or SMP program. And this is a program that helps Medicare beneficiaries protect, detect, and report healthcare fraud, errors, and abuse. As I mentioned, SHIP recruits and trains both volunteer and in-kind team members to provide services. And SHIP team members are highly trained and certified to assist people in obtaining coverage through options such as Original Medicare, that's Medicare Part A and B, Medicare Advantage, also known as Part C, Medicare Prescription Drug Coverage, Part D, and the Medicare Supplement, or Medigap. As Tricia mentioned, it is a bit of an alphabet soup, and the SHIP team members are there to help you decipher it. They can provide outreach by providing presentations, distributing information, conducting enrollment events, and participating in health fairs, senior fairs, and other community events. SHIP outreach helps inform groups and individuals about Medicare benefits, coverage rules, written notices and forms, appeal rights and procedures, and so much more. Just to put it in perspective, for the year we have the most data for prior to the pandemic, so things have pivoted a bit, but back in 2018, one-on-one health insurance counseling was provided to more than 2.5 million Medicare beneficiaries, their families, and caregivers. And I'd like to add, in the preliminary data over the last couple of years, this hasn't gone down that much. So the SHIP counselors were able to pivot, rethink how to provide services that were traditionally done on a one-on-one setting, and either provide them by phone or using new technologies such as Zoom and other web assistants. And additionally, in 2018, they provided outreach to more than 4 million individuals at public presentations, enrollment events, health fairs, senior fairs, and other community events. Next slide, please. I wanted to share how you can find your local SHIP. The website you see here is for our SHIP Technical Assistance Center. They serve as a central source of information, expertise, and technical assistance for our grantees, but they also host the SHIP Locator. The SHIP Locator you can access via the phone number on the site here or through the website shiphelp.org. So I'd encourage you to take a look, get familiar with who is providing services at the state level in your state, and then, of course, they can connect you with who's providing services locally. And I'm going to hand it back over to you, Tricia.
Thank you, Maggie. So helpful. Again, I just want to leave this up just for a second longer. Shiphelp.org is the website, and look here for that SHIP Locator to look for the state-specific way to find help. The SHIPs are great. I think it's very rare to get sort of one-on-one assistance in these days, and the fact that you can get it on something so complicated like Medicare is so super helpful. So I'm excited about our collaboration here. And again, we encourage employers, or if you're doing this for yourself or for a loved one, to use the SHIPs. That's what they're there for. They're here to provide that help. AARP has a number of resources as well, in addition to Medicare.gov, in addition to ACL and the SHIPs, and Medicare Right Center. AARP.org/Medicare is the main website to turn to for Medicare topics on our website. And we have all different kinds of information there. And this is all educational type of information. We do have a whole other arm of AARP that does have some Medicare products, but we represent sort of the social mission arm of AARP, the nonprofit side, and it's purely educational. AARP.org/Medicare Employer is where I would suggest you promote and recommend any employees or yourself if you want to register for more webinars like this. But we have a number of webinars that aren't just for employers, but for consumers, Medicare potential constituents, people who are just interested in topics in Medicare. It's anyone and everyone who's interested in Medicare can join these webinars absolutely free. We also have a Q&A portion of those. So if you want to ask questions during those webinars, we have them as well. The great thing is about this website, Medicare Employer, is that we have these webinars on demand. So if you wanted to take one step to do more in terms of educating your employees about Medicare, we have some really great on-demand sessions. I think we may even have one specifically on those who are working and Medicare, how to navigate that. We had one on open enrollment last year in the fall. So oftentimes these are recorded and they stay on the on-demand section, but we have some new ones coming up soon. I think the next one is in March. Or it just happened in February. So we have a number of webinars that you can offer as a lunch and learn, or watch together as a group if you want, or just at minimum send the link and people can tune in and fast forward or whatever if they want to just kind of tune into certain portions to learn about Medicare topics in these sort of educational type of platforms. So overall, what we covered is the basics. Even myself, who works in Medicare education, I don't probably even know the ins and outs of the complexities of Medicare. It gets complicated very quickly. So the basics is where I start. The SHIPs, I think, are the great place to go to for maybe some of those more in-depth questions, and they will point you in the right direction. You'll be in good hands there. So make sure to go to shiphelp.org. Educating your employees on Medicare is what we pointed out to you. We hope it doesn't seem like a very big lift. We hope that you have some great foundational knowledge to help you at least understand questions that might come your way when you get questions from employees, or if you're trying to navigate your own situation. Hopefully this was sort of a good primer, a good entree into understanding the basics of Medicare. And we know that it's not something that you necessarily need to become the expert on, but at least if you can know the resources and tools where to point people to, we hope that that was one of our goals today that we were able to accomplish. So we do have a few minutes for some questions. I think there's some that came up. Colin, are we going for questions, or did we want to do any survey questions first beforehand?
Yeah, I think let's do one quick poll. We'd love to hear from folks.
Great.
So everybody should see 3 questions on their screen. And we'd love kind of your perspective about whether or not the information today was valuable and useful. You feel a little bit more prepared to talk to your employees. And if you would share some of the information that was shared and would help your employees make more informed decisions. We're going to leave that up there for a second. As we're just always trying to get better feedback as we're continuing to kind of refine our presentation and some of our resources. So
yes, thanks for taking the opportunity to answer these. It would be helpful to us so that we can help shape our future information sessions. This is a topic that's fairly new in terms of educating employers around, because we feel that there are so many other competing priorities, but we know that there are some small steps that everyone can do to help prevent some of those common pitfalls and can help increase awareness and decrease confusion around Medicare, because it is an alphabet soup and it gets very confusing very quickly for some.
Absolutely.
So thanks for answering that.
I'll pull those down. And I know we have a few questions coming in through the chat. If you can submit those via the Q&A button, it just helps us track it a little bit better. We will share this presentation, a recording of this presentation out with you, along with a number of the resources that were mentioned and links to these organizations, just so that you can see. And so, Tricia, I know we have one about kind of coming in here about a federal employee who's about to turn 65,
Sure.
And how this looks and feels different for federal employees versus people who are in the private sector.
Sure, let me take a first stab. So my understanding is a federal employee who will turn 65 soon, but plans to continue working. So in this case, you are correct. You're told that if you continue to work while eligible for Medicare, you don't have to enroll. At your initial enrollment period, because you do have the alternative medical coverage, which is your employer-based coverage. So federal government, large employer, you are going to be in that situation where you do not have to enroll in Medicare. You can delay, or you can enroll in Medicare and it will be your secondary coverage to your federal employee health benefits plan. You can do that. The other option, if you delay, is just know that you're going to have, when you do retire, that special enrollment period that will be triggered, and you can, that's going to be 8 months. And if you delayed and you want to enroll in Medicare, then you would enroll at that point in time. Medicare would become primary when you retire, and your federal retiree health plan becomes secondary. I hope that helps.
Thank you. And then we have another question about self-employment, and someone who maybe has purchased health insurance from the ACA marketplace. When they turn 65, do they have to go on Medicare, or can they, and they're still working presumably, can they stay on their ACA insurance?
Ooh, that's a really good question. My understanding is yes. I'm sure actually some of the ships who are on might be able to answer that question, but I believe that actually you do have to transfer over to Medicare when you're coming from the health insurance marketplace. I am not going to say that I know the correct answer and point you in the right direction. So how about we follow up with that person afterward? We'll get the right answer over to you. But I'm thinking initially that the answer is you do have to switch over to Medicare.
Got it. Really helpful. And then Maggie, we have another question coming in about the counseling that you mentioned. I was wondering, if you could go into a little more detail about what that counseling looks like and feels like. If there's a small business owner here that's kind of referring an employee over to you, just to give a sense of kind of the process again. Because I think that might be really helpful for some of the employers on the line.
Yes, definitely. So I just want to say first that the last two questions that came in, those are the perfect kind of questions to call your ship about. They are well trained and educated on how all of the different types of insurance may interplay with each other and what is required of you as you're transitioning into Medicare. So again, I chatted in the number for finding that local ship, but I can do it again in a minute once I'm done talking. Ultimately, what's going to happen when you refer folks over to the ship is that they will get personalized assistance. They'll get a chance to sit down with a counselor, either virtually on the phone or in person, depending on how services are currently being offered. It does vary, right? Given where we are with the COVID-19 pandemic, it could be you have the option of one of them. It could be that they're only offering services one way. But either way, you'll get the chance to talk with a counselor who is trained and certified. So they are well educated on the ins and outs of Medicare. And they'll be able to talk with you about your specific circumstances and walk you through the different enrollment periods, when you need to apply by, what types of penalties you may be facing if you don't apply by certain times or you missed your enrollment period in the past. And then additionally, once you're enrolled annually, we really encourage folks to go back and review their Medicare plan choices during the open enrollment period that Tricia mentioned. So that's another time that SHIPs can really be helpful. They use the Medicare Plan Finder to really help people think through what is the best plan given their circumstances, and then provide unbiased options. They say, this is the information you gave me. Here are the choices based on what is provided by the Medicare Plan Finder. So there's no slant. There's no trying to push you towards one plan or the other. Really just good unbiased information.
Oh, that's incredibly helpful. And I think we have two more questions here, Tricia. One is there's some more questions about penalties and just kind of reiterating what may happen if people do not sign up on time and what those penalties look like. And then there's also a question about, beyond sharing resources, what are some other ways that employers can kind of educate and engage their employees around Medicare?
I'll answer the second question first, because I think that's easy. They're sharing resources, there's referring, there's actually referring them to the SHIPs, going to arp.org/Medicare for information. Medicare.gov, I mentioned, has a number of tools. Those are really helpful. But I think that sort of reminding function that we talked about in the initial enrollment timeline, where you could send out any kind of trigger reminders or letters or lists of resources around your employee's 65th birthday, around their initial enrollment period, that might be a really good thing to sort of tack on as your to-do. I think it could help. It could help save them from those penalties, which I can talk about. The other thing to think about is Medicare isn't just a one-time thing. The initial enrollment is important, but as Maggie addressed, we do encourage that you review Medicare coverage every year. So just like you most likely offer an open enrollment period for the health coverage, that employer-based health coverage that you offer, you may even tie that in with like a health wellness type of fair. Think about Medicare education during those time periods. If you're doing those kinds of activities anyways for your employees, that's another really good time. They're already reviewing their coverage plans. They're already making some decisions about benefits. Maybe Medicare is something that's not in the immediate horizon, but something that they may want to think about in the future. It's just a good opportunity to insert education where you can, because early and often, I think, is the best way to get the most firm grasp understanding of Medicare. And even with that, it's kind of hard to know everything, as you see with people like myself. It's difficult. So the question about penalties, I think you wanted to any specific, like I can pull up maybe the slide again.
Just the fact
about
that
penalties.
That I think there's some questions just generally understanding kind of the nature that if employees do not sign up on time when they're supposed to, they are at risk of a penalty, some that may last for the rest of their life. And so
exactly.
Just kind of
and there's penalties for Part A, there's penalties for Part B, and then there's penalties for Part D. I think the most significant of those is the Part B, if I'm understanding that correctly, because it's a 10% increase in your monthly premium for each 12-month period that you did not sign up, but you should have signed up. So if it's 24 months, that's 2 years worth that you didn't sign up that you could have. So I believe that ends up translating into a 20% increase in your monthly premium. And that will stick with you for as long as you have Part B coverage. I think the only time that you could potentially eliminate that is if you eventually become eligible for like an Medicare savings program or some kind of financial assistance. But these penalties, some of them will stick with you for life, and they're significant. 10% is already a lot. That's if you miss 12 months of your enrollment. But if you miss more and it's multiple years, that could be detrimental financially. But there's also a Part A penalty. I think that's a little bit more rare. And then the Part D one is 1% for every month, not 12 months, but for every month that you could have had Part D and you didn't. So 1% of the national average premium of the Part D premium. So pitfalls that we want people to avoid. And I think that's why we're encouraging employers to play a role, even though you may not traditionally have been involved in this kind of decision for your employees, but we know you care about them. We know you deal with other things in terms of benefits for the livelihood of your staff. And this is just extra helpful information that hopefully is not too big of a lift. And we encourage you all to refer, educate, and just provide help where you can. So we'll wrap up. We're a minute over. Sorry for talking so long. Here's my email address and phone number if you have any questions. Again, go visit arp.org. We have a new tool. It's the Medicare Enrollment Guide tool. arp.org/Learn Medicare is a great website to go to. As you may have noticed, we do a little bit of caregiving education as well. And so if you want to visit our caregiving information, we have some information catered towards small businesses and how you can educate your employees around caregiving. Sometimes Medicare is involved in that, sometimes it's not, but we have our website there. So thank you for your attention, for your questions, and we look forward to the next one. Thanks, Maggie.
Thank you all. This is now the end of the webinar. Have a great rest of your day.